first I'd like to thank our friends from the media for the work that you are doing as well. You know, your role in letting people know what's happening, helping people understand their role in the collective effort to contain this pandemic is extremely important. Thank you, John, for the invitation to join this press conference. I'm very pleased to have this conversation about what countries have achieved over the past 8 months and the priorities going forward in the COVID-19 response. First, I'd really like to appreciate John and the team at the Africa CDC and also colleagues at the African Union for the excellent partnership in this response and on other health priorities. The continental coordination of COVID-19 is exemplary and sets a new standard for strategic collaboration in global health. Indeed, we're at a pivotal moment in the pandemic in Africa. While the continent has experienced a downward trend in its epidemic curve during the past 3 months, this decline has plateaued, and John did share information about some countries in which, in fact, we're seeing an increase in cases. This comes as we witness a resurgence in new infections in Europe. African governments have also been reopening their borders and schools and relaxing restrictions on movement and gathering. This is essential. We cannot keep our economies closed perpetually. So the continent is at a key juncture where countries could experience, and we do see some experiencing indeed, an increase in cases, sometimes called a new wave increases. However, I'm heartened to see that many governments have used the time they had during the lockdowns to ramp up their capacities to curb the pandemic. Working together with WHO, the Africa CDC, and other partners, African countries are now in a much better position to tackle the new challenges COVID-19 is throwing our way. And here are some numbers which show the important advances that have been made. In February this year, there were only 2 labs in our region which could test for COVID-19. Now there are more than 750 such facilities and have spread beyond the capital cities into the districts in some of our countries. In April, there were fewer than 3,000 functional ventilators available. By August, there were more than 10,000. And in June, assessments WHO conducted of more than 1,200 health facilities found that many healthcare workers were lacking skills in infection prevention and control and how to keep themselves and their patients safe from the virus. WHO worked with the Africa CDC and many other partners to provide training in IPC, as we call it, to more than 150,000 healthcare workers. Our latest assessment shows an improvement in infection prevention and control, and our team is investigating whether this is leading to a decline in new healthcare worker infections. We know that healthcare workers are such a precious resource in our health systems, very inadequate, so it is very important to prevent them getting infected and dying of COVID-19. In addition to WHO staff working on emergencies, we have reassigned over 900 staff from other programs to work full-time on the COVID-19 response in countries and at the regional level. And we deployed, in addition, more than 200 international experts before the lockdowns started and borders closed. Our experience shows that control of outbreaks is won or lost at the local level. So we stationed response workers in cities where the virus tends to enter and in provinces and districts to ensure that public health capacities are built up and present in every community. In South Africa, for example, which is the worst affected country by far on the continent, a WHO search team was deployed to districts and hotspots, and we helped with an intra-action review that has enabled the government to refine the response at the local level. These reviews are also happening in countries like Malawi, Rwanda, and Zambia, and to ensure that the response in countries is being adjusted as the situation evolves. In Senegal, we moved quickly with the government to install new incident management systems in each of the country's 14 regions and at the district level, and worked to ensure that they functioned well. So while the lockdowns have helped countries to keep cases lower than the initial projections, these came at a high socioeconomic cost. Many income-generating activities have come to a standstill, wrecking the livelihoods and pushing people into poverty. The pandemic has also put a real strain on key supplies as countries across the globe compete for the same vital tools. So while countries still need more equipment, they are much better placed than a few months back thanks to the efforts of the Africa CDC, and John was just telling us of yet another delivery to countries that you are carrying out, as well as the efforts that we as WHO and other partners have made. Through the UN supply portal, over 48 million items of PPE, personal protective equipment, have been shipped to African countries, and 27 million are in the pipeline, and more than 4 million lab tests have been delivered, as well as 3,200 oxygen concentrators. We know that COVID-19 has disrupted other essential services, and so we've worked with partners to overcome stockouts of essential medicines like insulin, antibiotics, and provided guidance to resume immunization campaigns and other routine services with proper safety precautions in place for health workers and communities. We don't want people to die of other diseases because all our attention is on COVID-19. With partners, we've reached out to communities to raise awareness of the preventive measures, including the more than 345,000 community health workers mobilized across countries, and trainings with local leaders and influencers in 45 countries, with 250,000 participants who in turn will reach millions of people each month. Now we need to monitor adherence to the preventive measures and ensure that communities are enabled, they understand, and they are convinced to play their role. And John outlined this role very well, because they know that it's important, even if it's not pleasant and convenient. We do see fatigue coming in sometimes, but we need to keep up the effort. And I think most importantly, we need to make sure, working with governments, that, if I can't afford to buy a mask, that mask is made available. And people keep being reminded why it's important to protect your loved ones, and it's not just that you are obeying the orders of a government minister. So turning now to the COVID-19 vaccine. The rollout of a vaccine will be the biggest immunization effort in the history of the continent, we think. And massive preparations are underway through the COVAX facility, which is being coordinated by Gavi and WHO with the participation of many international partners and governments, to ensure that when a safe and effective vaccine is available, it's distributed equitably in 180 countries, or 90% of the world's population have now joined this COVAX platform. In WHO, we've established a regional task force for COVID-19 vaccines readiness and delivery. Through this task force, we will increase our technical support to countries, starting with the national regulatory authorities, because they have to accept and approve the deployment of a vaccine in the country. So we're working with them already in planning for vaccine approvals and distribution, and we'll work with governments to define the priority groups that should be the first to receive the vaccine in a phased delivery, because we know that there will not be sufficient vaccine for everybody in the country at the same time. I'd also like to echo before I go there, just to give you some updates as far as the COVAX and the vaccine is concerned. You may be aware that one of the main concerns is financing of both the procurement and, if you like, reservation with manufacturers of the vaccine supplies, and then also, very importantly, getting money so that the operations of deploying the vaccine are well funded and well organized in our countries. And we've had some very encouraging news in the last couple of weeks. The World Bank, a couple of days ago, the World Bank Board of Executive Directors approved $12 billion in financing for developing countries to finance both the purchase of the vaccine, including supporting some of the low-income and low-middle-income countries to make their own contribution, and also to support the delivery of the vaccine. And then on the 6th of October, almost $1 billion was pledged by several countries, the UK, Canada, Germany, and Italy, and Sweden, so that we are able to reserve the vaccine that is needed. And most importantly, so-called AMC-eligible economies, the countries that need support to pay their part of the contribution for the vaccine, can be supported. So we are working very hard at the international level to make sure that there is going to be vaccine availability to start in African countries as well as in the wealthier countries, and then we progressively phase in the deployment of this vaccine. I'd like to congratulate John and echo our excitement over the Africa Pathogens Genomics initiative, and just say that This builds on 25 years of experience through WHO's laboratory networks for different diseases, including the COVID-19 sequencing network that we launched together in September. This initiative will greatly assist in ensuring genomic information informs public health actions, and John explained that very well. Really, a huge congratulations for this giant step. In closing, I'd like to commend Africa's heads of state for their determined leadership of the response, supported by high-level multisectoral task forces and national incident management systems. These mechanisms were activated rapidly, and they've served as a vehicle to steer the response driven by the data. And in the coming months, we must remain vigilant in wearing our masks, in keeping a distance, in frequently washing our hands, because this must be our new normal. Recognizing that no one is safe until we are all safe, solidarity, equity, science should guide the response to address disparities that already exist and just were exacerbated by COVID-19 and reduce the risks, particularly for vulnerable groups. So I look forward very much to our discussion today. And again, John, thank you so much for having invited us, and thank you for the fabulous partnership that we have in order to work together for our continent. Thank you.